Hey everybody, Smart CRNA here. So today we're going to practice the Pomodoro Technique. This is a technique that's popular across a lot of the nurse anesthesia resident programs. A lot of high-level students are using this. So if you're not, you might want to try to incorporate it into your study. It's pretty much a method for staying focused and mentally fresh. You pick a task. So today our task is to do 100 questions. We're going to do it for at least a timer of 25 minutes. That's the time we're going to focus on it. We're going to work on this task until it is done. And then we're going to take a 5-minute break. And we're going to do it, for every 4 Pomodoros, we're going to take a longer 15 or 30-minute break. And the reason we're doing this is just think of your brain as you running outside, right? Like, let's say you're like, hey, I'm going to go do some sprints. And when you go do some sprints, you don't just do 10 sprints straight, right? Like once you pretty much do the sprint, let's say you're running 50 yards and you sprint and then you're like, okay, I'm going to take a quick 30-second break. Let me get my body and my respiratory function and everything back together, and I'm going to do it again. And where I'm going with this is that it's the same thing with your brain. Like when you're studying, just think of it as you're sprinting, and you need to give your brain just a slight break of focusing on something for 25 minutes and unfocusing for 5 minutes, then focusing again for 25 minutes, and then unfocusing again for 5 to 10 minutes, and kind of doing that to give your brain like a break, because that's going to help you retain the information a lot faster than just trying to cram everything down for 5 hours straight. But we're going to dive right into it. My test is tomorrow. As you can see, we have about 1,153 cards that is required for me to complete to be prepared for tomorrow. And we're going to go ahead and do that. So my goal today for this video is to do just 100 cards. So the goal is to get down to at least 1053. And that's it. Which cranial nerve is associated with taste of the posterior third of the tongue? That's glossopharyngeal. What is the primary purpose of conducting a prostate exam as described in the text? There has to be specific GI complaints, right? Genital urinary complaints, GU. Okay, what is the characteristic feature of adhesive capsulitis? So this is really just a lot of stiffness. They have restricted range of motion. This is common in diabetes patients. In orchitis, which parts of the male reproductive system typically become enlarged? So orchitis is enlargement of the testes, the entire testes, typically the epididymis. Only the epididymis, so entire testes. Yep. What conditions can a positive Near-Hopkins test? Positive Near-Hopkins could tell us it's a rotator cuff or a tendinitis. No, I'm sorry, it is not that. Rotator cuff is a positive empty beer can test. This is supposed to be a subacromial impingement. So I got that one wrong. I'm going to skip it because I know the answer. Which medication is most appropriate for treating overflow incontinence caused by BPH? It is, I think it's tamsulosin. What is the relationship between recent neurosurgery and headache symptoms? The relationship, recent neurosurgery, is risk of meningitis or hydrocephalus. Which of the following is not mentioned as one of the old cards? Onset, location, duration, characteristic, timing, associated symptoms. Which occupational or recreational activities can predispose a patient to impingement or rotator cuff tendinopathy? So impingement could be frequent overhead movements. What is a common characteristic of cluster headaches compared to tension headaches? Common characteristic of cluster headaches would be unilateral pain in the eye. What does a muscle strength of grade 0 indicate? No movement. I wanted to add something here. Let me see if I still have it. I don't know if I do. I don't know if I copied something. Oh, there it is. Yeah, I do. Yeah, I'm copying this to create photographic memory. I feel like I'm not too strong here, so I want to keep looking at this. Which physical examination test is most specific for confirming an LCL tear? That would not be the Lachman, because that's ACL. McMurray is meniscal varus. How can a patient's history aid in managing migraine symptoms? By identifying symptoms and triggers. What is the most likely diagnosis for a 35-year-old patient experiencing a burning sensation in the epigastric area, particularly at night after consuming GERD? What is the primary purpose of assessing deep tendon reflexes? To assess muscle strength exclusively, to evaluate the function of the nervous system? Yes. Which of the following is not mentioned as a part of the genital urinary review systems? Prostate examination is not. When assessing an upper extremity injury, what critical component should always be included in the examination? So we're assessing the upper extremity. What is a critical component? Range of motion testing, neurovascular status of the limb. I definitely was not going to pick that. So, so injury. Okay. So a critical component is a neurovascular status of the limb. Okay. That's good to know. Which of the following positions is suggested to make abdominal muscles less tense during examination? So you want to ask the patient to relax, like lie forward, exhale. Lie down, exhale, or bending the lower extremities of the hip. We'll relax it. What condition is commonly caused by excessive friction in the iliotibial band and lateral femoral? So iliotibial band tendonitis. A 40-year-old male presents with progressive tunnel vision and bumps into things on either side while walking. An MRI reveals a mass near the optic chiasm. This is not going to be on the exam, so I'm going to disable that. What symptom related to the prostate might necessitate a rectal exam? So if you have outflow obstruction, what should be the characteristic of normal testes upon palpation? They should be firm, distended, non-tender, without masses. When assessing an upper extremity injury, what critical component should always be included in examination? So you know that we got that one wrong. Neurovascular status of the limb. What is the expected normal range of shoulder flexion? That's not going to be on the exam. But you know what? I already disabled it. What does a weak response in the supraspinatus test likely indicate? So if there's weakness, not just pain only, or there's going to be a rotator cuff tear. A 70-year-old male presents with right upper quadrant pain, a palpable liver, and history of alcohol use. What is most likely diagnosis? So right upper quad, alcohol use, cirrhosis. What is the primary purpose of assessing the motor system during a neurological examination? To evaluate the muscle function, coordination. What is the significance of observing gait during a knee exam? The significance of observing gait during a knee exam is ability to bear weight, antalgic gait, meaning that you can't move. 25-year-old woman, so she's 25, purulent discharge pelvic pain, that's PID. Come on, man. What activities typically aggravate the pain associated with the iliotibial band tendonitis? What activities typically aggravate the pain associated with iliotibial band running downhill? Under what circumstances are kidneys usually palpable during examination? When they're enlarged. What sign during the Thompson test usually suggests a ruptured Achilles tendon? So if you have a Thompson test and the foot doesn't move, that's Achilles tendon. What type of movements are described as rapid irregular movements often seen in hunting chorea? A 24-year-old woman presents with burning during urination, increased frequency and urgency, but denies fever. So it's not infection or flank pain. So we don't have flank pain, which would be indicative of a kidney stone. She's 24 though. What is the most likely diagnosis? So pyelonephritis, we had cerebromotional tenderness. Vaginitis, we would have had discharge. Cystitis is like inflammation of the bladder. So I'll go with cystitis, inflammation of the bladder. Which of the following is a potential cause of confusion that should be ruled out during examination? Potential cause? I'm gonna go with drug intoxication. That's what I'm gonna do. Give me a second. 1 second. Let's go with the drug intoxication. What is the purpose of inspecting and palpating the surrounding tissues during joint examination? What is the purpose of inspecting and palpating surrounding tissue during joint examination? So we're doing this to to check for skin changes and nodules. Which physical examination finding is most indicative of past inserting bursitis? That's the one that I said where you have repetitive with active flex, like extension and flexion, repetitive movements. You get that. Tendon is 2 to 3 centimeters below the medial joint. I forgot. 32-year-old woman presents with burning urination, visible blood in the urine, but denies trauma. So she's 32, burning urination, blood in the urine. She had no trauma or fever. What is the most appropriate next step in her evaluation? So no trauma, no fever. So it doesn't look like there's an infection there. But she has blood in the urine. Just burning on urination. I mean, she's 32, burning urination, visible blood in the urine. That's not good. Denies trauma and fever. I mean, obviously we're gonna perform a urinalysis, but sounds bad. Sounds bad. A young athlete experienced a pop. Immediate swelling. So immediate swelling is ACL. What movement is associated with testing symptoms in the lateral foot? Testing symptoms in the lateral foot. So medial, dorsolateral. I would say that's walking on toes. Which physical examination finding is most indicative of pest insurance? So we said tendon is 2-3 centimeters below the medial joint. What history question is most effective in determining if a patient has stress incontinence? Stress. Do you leak when you laugh or cough? In younger patients with shoulder pain, which of the following conditions should be a focus of the differential diagnosis? So young shoulder pain should be like overuse injuries, right? Like it's definitely not osteomyelitis. It's not frozen. It's not osteo. It's not so AC joint injuries. An elderly patient. He's 66 years old. Sudden onset of wide-based veering gait followed by cerebral artery infarct. Cerebellar infarct. The patient has difficulty with coordination but no weakness. What is most likely? So cerebellar ataxia. Which type of trauma history should what type of trauma history should immediately raise suspicion for a fracture when evaluating back pain? What type of trauma history should immediately raise suspicion for fracture? Repetitive bending, no fall from height. What condition is most likely to cause referred pain to the right shoulder due to phrenic nerve irritation? Phrenic. That's the key one, is phrenic. Oh, I feel like I've seen this. It's not GERD. It's not peptic ulcer. It's not IBS. Maybe it's cholecystitis. Okay, so cholecystitis is associated with irritation of the phrenic nerve. That's good to know. I've seen it before. I just didn't remember well. Which shoulder condition typically does not cause pain during passive range of motion? That doesn't cause pain during passive range of motion. So passive is like if I lift your arm up. So frozen shoulder, you're gonna have that. Arthritis, you will. Tear, you definitely will. Arthritis, so I'm gonna say subacromial bursitis. Damn, rotator cuff, no. Oh, it's weakness. All right. Which muscles aid in wrist abduction? That's not gonna be on the exam. How can paraphimosis be prevented? Return to foreskin with glands. A patient presents with severe right-sided headache, proceeding with zigzag flashing light. That's a migraine. What movement is used to test L3-L4? So L3-L4 is your knee extension. How should the patient be positioned for breast examination? Lying flat on the head or bed, lying sitting on the edge of the table, sitting upright, arms to the side, standing on hands and hips. A 7-year-old patient with a history of prostate cancer presents with worsening back pain that is worse at night with new leg weakness. So it's not good. It's getting worse. What is the most appropriate next step? Urgent spinal imaging. Which cranial nerve is primarily tested for muscular strength by closing both eyes? That's cranial nerve 7. Which shoulder condition typically does not cause pain during passive range of motion? During passive rotator cuff tear, he said, which symptom is most indicative of trigeminal nerve dysfunction? So it's trigeminal nerve sets the motor and sensory function, so your absent coronary reflex. A 32-year-old woman presents with sudden lower abdominal pain after exercising during the middle of her menstrual cycle. She has no fever or discharge, so it's not infection, doesn't sound like something that's vaginitis, but a pelvic exam reveals tenderness on the side of her adnexa. So, that sounds more like a ruptured ovarian cyst. A 22-year-old woman presents with purulent vaginal discharge without odor and reports having new sexual partners and inconsistent contraceptive use. What is the most likely cause of her symptoms? She's 22, young girl, purulent vaginal discharge. So we'll do a speculative exam for something like this, which probably is already done, without odor and reports having new and inconsistent. So it sounds like she has, I want to say, it sounds like she has an STI. I don't want to say pelvic inflammatory disease, because usually pelvic inflammatory disease is purulent. But is it gonorrhea or chlamydia though? Bro. I'm going to say because of the sexual history, I'm going to go with gonorrhea and chlamydia. It's a complication of untreated STI. So if it gets untreated rather than direct cause of purulent discharge, which is more indicative. All right, cool. Which action is pointing the fingers toward the floor? That is flex. Why is it important to compare sensory function between distal and the proximal trunk to identify neurological deficits localized? Yes. Which muscle is the supraspinatus? We did this. What are two general approaches to taking a history of headache complaints? Alarm features and typical features of a night. Yes. We want to know that. Yes. And a patient experiences sudden severe pain around the eye accompanied by tearing, nasal congestion, and eyelid drooping. Okay. The headache occurred. That's a cluster. A patient reports experiencing intense pain behind one eye. Occurs every night. That's cluster again. Which of the following is not mentioned as a test for evaluating ligament injuries? So we know what ligament injuries is all of these. This is not a ligament injury. What does weakness during dorsiflexion and plantar flexion test? What does weakness during the dorsiflexion and plantar flexion strength test potentially suggest? So dorsiflexion, plantar flexion of the foot. What are we looking for? Muscle strain or nerve involvement. Which of the following behaviors is most characteristic of a patient experiencing a cluster headache? Crying, covering eyes, no. Pacing and agitated. Yes, because these patients are restless because the pain is so severe. They're running everywhere. Which cranial nerve is primarily responsible for tongue involvement? For tongue movement. That's the hypoglycemic nerve, cranial 12. What should be observed regarding the patella during knee palpation? The patella should be, is it mobile? Why is it important to determine the patient's dominant hand when dealing with neurological complaints? Because it corresponds to the dominant hemisphere of the brain, which guides the exam. Which conditions can be associated with loss of position sense and vibratory sense? Remember, we talked about this. That's the multiple sclerosis, the malnutrition due to B12, diabetic neuropathy due to loss of sensation, and syphilis. So conditions can be associated with loss of position sense and vibratory sense is MS, B12. What is the next best question to ask a 36-year-old man who reports dysuria and low-grade fever? So it sounds infectious. It's burning when it's paining. Considering the concern for a possible ascending infection, do you have any associated symptoms? When asking a patient with abdominal pain about the pain, when the pain started and what affects its intensity, which aspects of the symptom are you primarily assessing? So when asking about patient with abdominal pain, about the pain, when did it start? What affects it? So we're asking duration and modifying question. Which of the following is an alarm symptom that could indicate metastatics. So that's painless, all bad, and shoulder pain. So unexplained weight loss, because why is he losing weight? Which is the following symptoms considered an alarm system when evaluating confusion? I'm gonna say fever because of meningitis. What feature suggests a functional gait disorder? Visible muscles, nope. Consistent weakness, functional. So you got like a broken leg. Abnormal reflexes corresponding to affected legs. Abrupt onset after emotional trauma. So psychological. What is the purpose of the McMurray test in the knee examination? The McMurray test evaluates meniscus injuries. Why is it important to ask about recent drug use when evaluating confusion? It helps determine the patient. It's unnecessary. It's only important for legal reasons. It can lead to confusion. Because drugs can lead to confusion, yes. When evaluating a patient for a headache, what is important to determine? New or chronic? If it's a new or chronic, you've been having headaches for a while. What clinical condition may be indicated by the absence of bowel sounds on auscultation for more than 2 minutes? Peritonitis or paralytic. What is one of the most common reasons for healthcare visits related to headaches? One of the most common reasons for healthcare visits related to headaches. This looks like a bad question. Is it headache? Yeah, this is a bad question. How is strength assessed in the foot? Having the patient push against resistance and dorsiflexion and pathophysiology. What are the red flag symptoms that indicate a need for urgent MRI of the spine? Urgent MRI of the spine is like if you have like loss of bladder control, lower limb weakness. Which of the following conditions specifically mentioned as part of the past medical history for women when assessing abdominal pain? Well, past medical history, you want to know if they've had any type of ectopic pregnancies or anything that may give us a clue as to why. Like breast cancer, I mean, this is abdominal pain. Polycystic, I mean, it could cause abdominal pain. I'm going to go to the topic. Which clinical feature best distinguishes a medial meniscal tear from other injuries such as ligament sprains? So locking and clicking, that's the key thing with meniscus, is that it locks and it clicks. Which cranial nerve is responsible for vision and will be affected if a patient has difficulty reading signs and experiences reduced peripheral vision? So they have difficulty reading signs and reduced peripheral vision. I know difficulty reading is cranial nerve 4, but peripheral vision is your ability to look outward. So it's cranial nerve 2. Okay, I overthought that one. Which clinical test is used to assess suspected AC joint arthritis by having the patient cross their arm over their chest? So that's the cross arm test. Which reflex is tested by placing a thumb on the biceps tendon and striking it? That's the biceps reflex. Which symptom is more characteristic of disc herniation compared to spinal stenosis? Which symptom is more characteristic of disc herniation compared to spinal stenosis? Which symptom is more characteristic of the... Okay. This is my weak question right here. I always mess this one up. But today we're going to get it right. Pain that improves with sitting. Everybody told me that that's not disc herniation, that's spinal stenosis. So it doesn't improve with sitting. Pain that worsens with prolonged standing is spinal stenosis, so they need to lean forward. Worsening pain when walking downhill. I don't know. Bilateral leg pain, doesn't matter. So, which symptom is more characteristic of disc herniation? Wow. I don't know why it's saying this. Because I would think that with disc herniation, pain that worsens with prolonged standing, I think, this is a botched question. Pain that improves with sitting is a hallmark of disc herniation as it often relieves pressure on the affected roots. contrasting with spinal stenosis with symptoms. I don't know, man. I gotta mark ahead with a message. Confirm this. I am confused. Which cranial nerve is responsible for vision? We talked about this. Cranial nerve 2. Which test is specifically designed? So this is the cross arm test. What condition is most likely causing anterior shoulder pain when lifting items when the palm bicep tendonitis? Come on. At what angle is the Lockman test done? So the Lockman is done at 30 degrees. Which muscles are involved in knee extension? Knee extension, quadriceps. What test is commonly used to evaluate for sciatica and lumbar radiculopathy in patients with back pain? Ooh. What test is commonly used to evaluate for sciatica? I mean, it could be the straight leg test and it could be the cross leg raise test. Like, it could be either one of these. What might loss of vibratory sense indicate in a patient? Loss of vibratory sense? Neurological issues related to various conditions. That's your multiple sclerosis, your B12 deficiency patients. That's your syphilis patients. In the context of confusion, what does post-ictal state? The state of alertness before it's the state of confusion after a seizure. What is the most likely diagnosis for a patient experiencing medial knee pain, catching and difficulty fully extending the knee after a twisting? That is a meniscus injury, but it said medial, so medial meniscus. In which condition is diplopia worse when focusing on distant objects? I mean, the boys told me too, but I know it was 4. And I'm wrong again. Goddamn. Oh Lord, forgot. What is the most important history question to ask a patient to differentiate between an acute injury and chronic pain? What is the most important history question to ask a patient to differentiate between acute injury and chronic pain? Acute injury and chronic pain. Okay. Does it hurt in the morning? The joints. I guess. Have you had this pain before? Which of the following statements about knee injury is correct based on the information provided? Knee injury. A varus blow to the knee causes medial. No, that is not true. No. Twisting and locking. No. An ACL tear always result. No. Yes. What should be prioritized when evaluating a patient for confusion, especially if it's begun acutely? Waiting, asking, focusing, identifying potential alarm systems. What factor makes a UTI less likely to diagnose of a 35-year-old male with burning urination and frequency? Well, he's a male. It's harder to get a UTI. In which condition is diplopia worse than focusing on objects? So now we're going to go ahead and we're going to take a break. We did our 100 questions that we wanted to do. We did it in 28 minutes. And we're going to take a brain break. But overall, it was a good study session. I hope you found this technique very interesting. I'm going to go take a break. I'm going to eat some cookies, man. I'm going to drink some water. And I'm going to come back and I'm going to get right back at it. Good luck, everyone. I hope this kind of helps you learn how to retain information a lot better. I hope you got something out of this video. If you like it, subscribe, share with your friends, and we are trucking along to our examination. So we're almost there. We're almost to the sunshine. All right, y'all take care. Take it easy. We are on how many days of studying? 1, 2, 3, 4, 5, 6, 7, 14, 21, 22, 23, 24, 25, 26, 27 straight days of flashcards. 27 straight days, almost a month, every day. Every day we are hitting cards. All right, y'all, take it easy.